Good morning, Dr. Griffith. I'm Tashira. I'm one of the Albany State Nurse Practitioner students. I'm here to conduct a complete head-to-toe assessment on you. Do you consent to my video?
Yes.
Perfect. I'm going to start by asking you a few questions. Can you tell me your full name?
Oliver Griffith III.
Okay, and what year is it?
2024.
And who was the previous president?
Donald Trump.
Okay, and one last question. If you were ever pulled over by the police for running a stop sign or a stop light, and were given a ticket, how would you react?
I would accept it and pay it.
Okay, so his judgment is reasonable, and his cognition is he's A&O times 4. So I'm going to start by conducting a general assessment of your skin, hair, nails, and eyes, ears, and nose. Okay. So first off, his skin is it's intact. No lesions, no bruises, no scars noted. Hair is well groomed, clean, and evenly distributed about his head. His head is round and symmetrical. His ears are symmetrical to one another. Eyes, take a look at your eyes. All right, his conjunctiva are pink, sclera are white. His lacrimal glands are intact. No drainage noted there. His eyebrows are thick, groomed, and hair is evenly distributed bilaterally. Lips are pink, moist. And let's see, let me check your skin target here. Skin target is less than 2 seconds on the left as well as the right. Nail beds, they're clean, intact, no clubbing. Capillary refill is less than 2 seconds as well. Gonna start now. I'm gonna look into your ears here. All right, there's no drainage, no redness or irritation noted in the ear canal. His tympanic membrane appears to be a pearl. Have you look at my chart here. I'm gonna check your eyes first. Check your eyes first. And his pupils are equal, round, reactive, and accommodating to light. Look at my Snellen chart now and cover your right eye for me and read the lowest line that you can read.
OFBHJ.
Okay, and let's do the opposite eye.
OFBFJ.
Okay. So what I just conducted was a test on his cranial nerve 2 and 3, optic and ocular motor. All right, I'm gonna move on to olfactory. I'm gonna have you close your eyes and I'm gonna have you smell something. You tell me what you smell.
Vanilla.
Okay, keep your eyes closed.
Peppermint.
Okay, and that is olfactory, which is sensory nerve 1, which is smell. All right, I'm gonna take a look now in your nose. You can open your eyes. All right, his nails are pink, no drainage, and patent. Take a look at your mouth now. Once again, I said the lips are pink and intact and moist. His tongue is midline smooth, pink and moist as well. No jagged teeth, no chipped teeth. Mucosa are pink and moist and intact as well. All right, you can close your mouth. Now I'm gonna feel for your sinuses here. This is his frontal, ethmoid, maxillary. Any pain or pressure?
No.
All right, great. take a look at your neck. There's no jugular vein distension. The trachea is intact. Carotid pulses are palpable, about 2 plus. Listen to your carotid. Okay, and there's no bruit noted in the carotid. His temporal artery, take a listen here. All right, and there's no bruit noted there as well. All right. This is his thyroid gland. It is slightly palpable. It's midline, no deviation to the left or right. It's easily movable. Have you tilt your head for me? All right, and swallow. All right, great. Let me do your sinuses. All right. Palpate for his sinuses now, or lymph nodes. I have the pre-auricular, post-auricular, his occipital, carotid and tonsillar. I have his submandible, submental. I have the anterior cervical, deep cervical, posterior cervical, and supraclavicular, and there's no swelling noted there. His chest, respiratory and cardiac wise, I'm gonna stand here and I can note that his AP diameter is 1 to 2. His chest, there's no accessory muscle use, easy rise and fall of the chest. Respirations are about 16 to 17. Gonna feel here. All right, take a deep breath for me. All right, and his inspiration, expiration is even, rise and fall. Take a deep breath. All right, and the same bilateral. Tenderness.
No.
All right. Percuss now. Now I'm going to percuss the anterior chest. Laterally. All right, do this side. All right, and there's no dullness, anterior or laterally, bilateral. Posterior percussion. All right, and there's no dullness posterior. Let's take a listen. Laterally. All right, and his lung sounds are clear, equal bilaterally, anterior, posterior, and laterally. Precordium at the second right intercostal space is the aortic. The second left intercostal space is pulmonic. Down at the third intercostal space is herbs. Fourth intercostal space, I have tricuspid. Fifth intercostal space, I have mitral. And then in the epigastric region, just below or above the umbilicus is the epigastric. All right. Any pain, tenderness, pressure?
No.
All right, so what I was feeling for was for heave or thrill, and then listen with the bell and the diaphragm. All right, we're gonna have you lay down because I need to listen with you laying and then laying on your left side. So I pause. All right, and now I'm gonna listen to the precordium with him lying with the bell and the diaphragm once again. Okay, and I'll get you to turn on your left side for me. Okay. Listen laterally, bell and diaphragm. This arm. All right, and there's a normal S1, S2, no murmurs noted. All right, we're gonna conduct an assessment on the cranial nerve 4 and 6. 4 is trochlear and 6 is abducens. I'm gonna have you look at this for me and just follow. All right, and there's no nystagmus, no involuntary jerking of the eyes. Next, we'll move on to cranial nerve 5, which is trigeminal. Have you clench your teeth for me? All right, and I'm gonna have you close your eyes. And what I'm gonna do is I'm gonna touch a part of your face. It's gonna be either sharp or dull. You just let me know which part of the face it is and whether it's sharp or dull.
Sharp left temple. Soft right cheek. Sharp right temple. Soft left cheek.
All right, and now I'm gonna test the upper and lower extremity sensation. Just let me know whether it's sharp or dull again and what part of the body.
Soft left arm. Soft right leg. Sharp right arm. Sharp left leg.
All right, so his sensation is intact in the face and the upper and lower extremities. Now I move on to cranial nerve 7, which is testing the facial muscles. And what I'll do is I'll have you smile big for me. All right, relax your face, lift your eyebrows, relax. and puff out your cheeks. All right. And cranial nerve 8 is acoustic, which is testing his hearing. I'll have you cover your left ear for me. I'm going to repeat a number or phrase, and you just repeat it back to me. 246.
246.
All right, and cover your opposite ear. Popcorn.
Popcorn.
All right, that is the whisper test. Cranial nerve 9 is glossopharyngeal, and 10 is vagus, and that's gonna test a gag reflex. So have you open your mouth for me. So say ah. All right, and his gag reflex is intact. Cranial nerve 12 is hypoglycemia, and that is testing the muscle and movement of the tongue. So what I have you do is stick your tongue out for me, move it up and down, perfect. Put your tongue in, touch your left cheek, right cheek. All right, great. And cranial nerve 11 is accessory muscle. So I'll have you lift your shoulders up, raise your shoulders. All right, and raise them again. Don't let me move them down. Perfect. Relax. So his shoulders are symmetrical, even muscle tone and strength. That is it for that. Now we're going to move on to, let's do your coordination first. So what I'll have you do is take your pointer finger, touch your nose, and touch my finger. All right? Keep doing it until I see you stop. All right, great. And now I'm gonna have you pat your legs. Okay, keep going, faster. All right. Next, I am going to test your gait, which is the tandem walk. I'll have you stand here and just walk in a straight line as possible, heel to toe. All right, good. So his gait is steady, no wavering from side to side. He passed that test. I have you sit down. We're going to do your deep tendon reflexes now. Start with the bicep area. Okay. There's a flicker in the bicep, the back of the arm, and the lower forearm here. Do your tricep. Bend your arm just. Yep. Okay, and there's a flicker in this muscle as well. So the brachial radialis is 2 to 3 centimeters above the radius pulse. Okay, there's a flicker in the finger. Let's do the opposite side. Okay, there's a flicker in the upper and lower arm. Back of the arm, go just above the elbow. And there's a flicker in that back upper part of the arm, brachial radialis. Okay, and there's a flicker in his fingers. Now we'll move on to the patella. Okay, and there's a flicker in that lower leg and foot. And again, there's a flicker in the foot here. Okay, there's a flicker in the ankle and the toes. This one. Okay, and the same reflex in the right foot. Now we're gonna do the Babisky. All right, and there's no flaring of the toes. And again, no flaring of the toes. Now I'm going to assess his major pulse areas. We have the popliteal, which is located behind the knee bilaterally. They are palpable about a 2+. Right here, I have the dorsalis pedis, which is on the very top, anterior, medial part of the foot, and they are palpable as well, about a 2+. Posterior tibia. Okay, and they both are palpable. I would rate them at a 2+. This is his radial pulses. They're both palpable at a 2+. And then the brachial. And they also are palpable at a 2+. So now I'll move on to your abdomen. I have you lay down with your head this way, feet facing that way for me. Move the camera. All right. So now I'm gonna assess your abdomen. Just put your shirt up. All right. So I will note that his abdomen is flat, non-distended. His umbilicus is central and midline. The color is even and appropriate for race. No masses, no abnormal pulsations noted. I'm gonna auscultate in each quadrant. Okay, and now I'm gonna auscultate the aortic region, which is just above his umbilicus, right renal, left renal, left iliac, right iliac, right femoral, the left femoral. All right, and now I'm going to percuss his belly, starting with the right lower quadrant. All right, and there's no dullness, it's tympanic throughout the entire abdomen. Next, I'm going to percuss for his liver border, which is located here on the right side. I will start along the right mid-clavicular and percuss upward and then downward, starting along the umbilicus region. Okay, so I'll note the bottom part of the liver border here. You'll give me that finger, just your index finger, and point it there for me. And I'll start downward, starting around the left or the right third intercostal space. Okay, I'll note that there, and I'll measure between the two borders. All right, and I have about 4 to 5 centimeters. Thank you. All right, now we're gonna percuss for the spleen, which is located on the left mid-axillary region. Let's see if I can move that back a little bit. Okay, and I'll repeat the same. Start at that last rib area and percuss downward. Okay, note it there. Now start at the hip bone and percuss upward. Let me get your finger once more. Right there. All right. Okay, and this would be my splenic region. Next, I'm going to palpate. Start with light palpation with the tips of my fingers, going no more than 1 centimeter. All right, any tenderness?
No.
All right, so the belly is non-tender. Next, I'll do deep palpation. All right, and again, no tenderness reported, no masses palpated. And while I'm here, I'll go ahead and locate the umbilicus, go just above it and palpate for an aortic pulsation. So I'll go deep and inward. Okay, and there's a pulsation noted. Midline to the umbilicus is not deviated to the left or right, which would not be indicative of a aortic aneurysm. All right, let's sit up for me. Oh no, one more thing, I'm sorry. Rebound tenderness. So I'm gonna press down on your abdomen, and once I release, you let me know if it's tender or any discomfort. All right.
No. No.
All right, now you can sit up. All right. Now we're gonna, the coastal vertebral angle, which is testing for any tenderness in the back area, which would be indicative of kidney inflammation of pyelonephritis. So I'll locate that 12th rib, and you're gonna feel me tap on your back, and you just let me know if it's tender or not.
No.
All right.
No.
All right, so that test would be negative. Let's pause our camera and do musculoskeletal. This is the last. All right, now we're doing musculoskeletal. I'm gonna hit the neck, and head is midline to the shoulders. The shoulders are even in muscle tone and strength. I'm gonna have you, let's see, hold out your arms for me. I'm gonna palpate his joints for any nodules, masses, tenderness noted. All right, any tenderness?
No.
All right, and no nodules or swelling noted. Next, I'm gonna assess his head movement. So I'll have you take your chin to your chest, flexion, all right, and back up. And go back for me, that's extension, right? And let's, your ear to your shoulder, all right? Opposite ear, good. All right, now I need you to do that again, but don't against force, there you go. All right, good. Let's turn your head to the side, opposite side for me. Great. Shrug your shoulders up and down. Okay. Now we're gonna move on to your arms. Take your arms out to your side for me. That is abduction. Bring them back. All right. Now I need you to take your left arm, reach across your shoulder. All right. Good. And I'll do it for you. Okay. And let's do the opposite arm. All right. And I'll do it for you. All right, good. And now I need you to take this arm and pat yourself on the back. All right, that's external rotation, and do the opposite arm. All right, good. Now I need you to go behind yourself and touch your scapula. That's internal rotation. Do the opposite one. All right, good. And let me see your hands. All right, spread your fingers out. That's adduction. Bring them back together. I'll do it for you. All right, and fingers like this, flexion, extension. Take your wrist in. All right, good, and back out, perfect. And go like this. All right, great. All right, and now I need you to stand for me. All right, so his spine is straight and midline. I have you bend over, touch your toes. All right, and again, it is straight and midline. You can stand up for me. I'll have you lean side to side. Okay, opposite side. Good. And twist. Okay, good. Now I need to test your hip flexion and extension. So I'll have you lay down for me.
Which way? That way.
Yeah, you can lay feet this way, head that way. All right. Down a little more. All right, so his hips are even in midline. They are symmetrical, one's not higher than the other. So what I'll have you do now is put your legs together. We're gonna do one at a time. Take this one out for me. All right, that's abduction. Bring it back in. Do this one. Okay, that's abduction, adduction. Now we're gonna do it again, but don't let me bring your leg back in. So adduct your leg. All right, and okay, perfect. And the same here. All right, good. Now let's take this knee, bend it for me. Place your knee there. All right, this is external rotation of that hip. All right, take this one down. Let's do the opposite one. All right, again, external rotation. All right, take this knee, bend it. That's flexion. You up. All right, don't let me pull it down. Okay, good. Same flexion, up. Don't let me pull it down. All right, good. All right, and that is, we just assessed the hip movement. We're gonna do your feet here. So, on your ankles, I mean. Take your ankle inward, outward. All right, let's do this one. Same thing, outward and in. All right, and I'll have you take a seat for me. Oh, and I'll have you do what we call flex your foot for me. Take your foot, go down for me. All right, flex it up. All right, good. Do the opposite one for me. Up and down. Great. And that is the dorsal reflex and plantar reflex, and those are intact. And that concludes our video.